Good afternoon. Thank you for joining us here today, and thank you as well to Dr. Roussin for being here. Today we're here to discuss an update to public health orders. Rising COVID-19 transmission, case counts, and the introduction of the Omicron into the province means we need to introduce new measures and introduce them now. We need to delay the emergence of Omicron to give all Manitobans time to get their third dose and reduce the demands on our healthcare system as much as possible. Case counts and hospitalizations are rising, and we must be proactive in protecting our healthcare system. We need to ensure that we continue to have hospital beds available to provide care for patients in need. Once again, we must ask Manitobans to do more to reduce the current COVID-19 case numbers and community transmission. This will help reduce the strain on the healthcare system. We're not helpless in this fight. We need everyone to work together by following the public health orders, focus on the fundamentals, and get vaccinated. This includes getting your third dose as soon as you are eligible. And I want to thank the hundreds of thousands of Manitobans who have participated in our historic vaccination efforts thus far. You did your part by rolling up your sleeve to protect yourself and your fellow Manitobans. And to all of you, I say thank you. I will now pass it over to Dr. Roussin to expand on the new public health orders. Dr. Roussin.
Well, thank you, Minister Gordon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Earlier this week, I provided Manitobans with an update related to the Omicron variant. We've continuously urged Manitobans to get vaccinated, whether that be their first, second, and now their third dose. At this point, from what we see on the significant increase in transmission of the Omicron variant, we need to go further. I come today with a message that I didn't want to have to convey, and probably none of us wanted to hear. It's not easy for any of us, but of course we all want to do what it takes to protect the health of Manitobans. The current COVID-19 case numbers, the facts about how quickly Omicron is being transmitted in many jurisdictions, and that impending community transmission of Omicron here in Manitoba is very, very concerning. This requires us as a province to take decisive actions in the short term to prevent the long-term harms that we know Omicron can do. We know that no one wants to hear news of new public health orders. But as we enter this holiday season, we must work together as Manitobans to slow the spread of Omicron. This is to protect our healthcare system, to protect those Manitobans most at risk of severe outcomes, and ultimately the well-being of all Manitobans. So the following new public health orders will take effect in our province as of midnight on Monday. Therefore going into effect early Tuesday morning. So firstly, the indoor public gatherings will be restricted. So gatherings with all vaccinated individuals will be allowed to have the household plus 10. If there is anyone who is unvaccinated in the household or the group that's attending, this will be the household plus 5 guests. This does exclude children under age 12 for the vaccine requirements. For public indoor gatherings, there will be a 25% capacity restriction or 25 people, whichever is lower, and that's where proof of vaccine is not required. For outdoor gatherings, a maximum of 50 people can gather without proof of vaccination or a 50% capacity at that location. For gyms, movie theaters, licensed premises, museums, libraries, the proof of vaccine requirement remains, but on top of that there is a 50% capacity restriction. In licensed restaurants, guests will be required to remain seated and will only receive seated service. And restaurants, both licensed and unlicensed, will be allowed to have a maximum of 10 individuals per table. For faith-based gatherings, where proof of vaccine is required, there will be a 50% capacity. Where proof of vaccine is not required, it will be the indoor gathering sizes of 25 individuals or 25% capacity, whichever is lower. Indoor and outdoor sports, there will be no tournament that can take place. Games and practices will be allowed. Spectator capacity will remain proof of vaccine, but also reduced to 50% capacity. For large indoor events, they will remain at proof of vaccination, but will also be reduced to 50% capacity. We're introducing these new public health orders with a focus on several different approaches to continue to protect our communities, protect Manitobans, especially those most at risk. These restrictions will be in place for 3 weeks and will last till January 11. We'll continue to be clear and update you as we evaluate and monitor the situation. And like in the past, there are many factors that we take in consideration as we monitor the spread of infection. These are things like case numbers, test positivity, community transmission, vaccine rates, modeling, and as well as the strain on the acute care system. So we are seeing very concerning numbers right now in many jurisdictions with Omicron, and that's why we need to take these actions now. Projections are indicating that there will be much more challenge to our healthcare system and our communities, especially if we do not take these steps at this point. So again, I'd like to thank all Manitobans who are following the public health orders, who are focusing on the fundamentals and have been vaccinated. You'll see that for the first time since we've had widespread vaccines, we are now imposing restrictions even on the vaccinated. And this is really because vaccine effectiveness against Omicron is reduced. There is still that benefit to being vaccinated, especially against severe outcomes, and that benefit is increased with that third dose. So again, encouraging Manitobans to get vaccinated, whether that's your first, second, or third dose as soon as you're eligible. But right now, from what we're seeing with Omicron, we have to take these steps now, even including restrictions that involve the vaccinated population. It's absolutely frustrating to be here again for all Manitobans, but we've been here before, we've stepped up before, we've gotten through this, we'll get through this one, but we need to do so together. So thank you again, and we'll open it up for some questions.
Omicron cases in Manitoba. Why do this now? I know that we have to intervene early, but at what expense does this have to the social and economic impact of Manitoba?
So we do see, the reported cases that we've had of Omicron have been relatively low at this point. We know that from other jurisdictions it doesn't stay that way for very long, that we'll see a rapid doubling. And I don't have specific numbers, but we have a significant amount of screened Omicron at this point. So we're not going to be at 8 very, very shortly. So all of our indications are that that Omicron is here, it's spreading, and we need to act now.
You mean community spread?
I don't have all the details, but when you see these this amount of cases and what we know from Omicron from other jurisdictions, it's going to spread. It's going to be in the community, and so this is why we need to act.
But you don't know if it's spreading right now? Because on Wednesday you said you weren't aware of community spread.
That's right. On Wednesday with the confirmed, the 6 to 8 Omicron cases, we had them all linked. From what we'll see is it's very likely in the upcoming days we'll be able to clearly say we have community transmission.
I believe you got capacity limits on a lot of things here. In restaurants, it's just per table. Is there not? Sort of
No, it's 50% capacity. So that's sort of the overall theme of it is even where there's proof of vaccine, those venues will be 50% capacity.
So with the new restrictions, what will this do to the modeling that shows 1,000 cases a day by the
So it's really tough to put specific restrictions because there's so many variables on there on adherence to it. So what we know is that if we can significantly reduce our contacts, and it's mentioned 50% by 50%, we're going to see a blunting of those numbers. We're not going to stop Omicron. Omicron's going to be here. It's going to climb rapidly, but if we can significantly reduce the amount of contacts we have outside of our household, we can buy more time to get many more Manitobans vaccinated.
We have Manitoba modeling at this point. On Wednesday, you were using numbers from Ontario and the UK. At this point, do we have Manitoba modeling? And if so, what does it look like?
Well, we have, again, the Manitoba modeling that we had, much like I showed there, it can only be an extrapolation. We have so few cases that are confirmed right now, so we can't use our data to drive modeling. But if there's no reason to think that it would look any different here than anywhere else.
You told us to rethink our holiday gatherings. Should we cancel our holiday gatherings?
Well, the holiday gatherings should absolutely follow these restrictions. So that would be my, that's what these require. My thoughts are that everyone, in addition to these restrictions, need to take in consideration their personal risk assessment. If you or someone you love is at high risk of severe outcome, then you need to reconsider just how many people need to be in your bubble.
How are we set for contact tracing? I'm just thinking if Omicron picks up speed and our rate is so high, how are we going to manage that, especially over the holidays?
Yeah, and so when you look at a virus that is so infectious as Omicron, that has a fairly short incubation period from what we've been seeing, we need measures such as reducing contacts and vaccine to really stop it. Our contact tracing will continue, but we're actually making changes to our contact tracing to focus more on high-risk scenarios. We're actually wanting to divert some resources from contact tracing to vaccination programs. That's where we feel is going to be the most impact.
What about rapid testing if people are going to be having these gatherings? Will we have this before the holidays?
So with the rapid testing, I think it's definitely a tool that we have, and we're going to be utilizing that. There is some access to that, and we're looking at increasing it. But it's only going to be useful if we add it on to these restrictions and use it appropriately.
I do just want to point out, or just repeat what you just said there. You do want to divert resources away from contact tracing at a time when cases are going to increase significantly.
We want to, we want to divert resources to vaccination, and so our resources will come largely from contact tracing. And so remember, when you're talking about a highly infectious variant that has a relatively short incubation period, the role of contact tracing is diminished. So it's still going to be there. We're still contact tracing. We're still contacting cases. We're still going to do this, but it's much more important to have the population vaccinated.
It'll take longer to do contact tracing than with less staff.
It depends. It depends on how we approach it. We're going to, in many ways, have in lower risk situations have cases contacting their contacts and informing them. In high risk settings, we'll still be quite involved.
What about enforcement?
One more in here, and then we'll go to the phones.
Any increased enforcement? People, looking for those folks skirting the rules?
Well, we're going to continue to work with the Department of Justice on enforcement and ensure that enforcement is stepped up, and that individuals who are not abiding by the orders that we have stated today are held to account for that, because we want to reduce that community transmission.
All right, and with that, we'll go to the phone.
Thank you. A reminder to our reporters on this session. You will have one preliminary and one follow-up question. Up first this afternoon from Canadian Press, Brittany.
Hi there, good afternoon. Just wondering why there would be no restrictions on unvaccinated people in households. Why not just say that unvaccinated people cannot gather in a household with vaccinated people?
So the private gathering. So if you have a gathering that includes all vaccinated people, then they will have the ability to have the household plus 10. If there are any unvaccinated people either in the household or the guests, then that is reduced down to 5. So it is more restricted.
Okay, I guess I would just be wondering why not just say that they would not be able to gather.
Well, I mean, I think that this is part of that balance and what we think, will be adhered to. Right, we have the holiday season approaching, and do we feel if we tell people they're not able to gather with anyone, whether that's a realistic expectation?
Hoping that wasn't my follow-up question, but I'll just try to squeeze one in. Will we ever get to a point, like with Jets games or sporting events or things like that, where it will go back to no crowds are allowed? Already seeing it happen in other cities.
So things are developing rapidly, right? I was out on Wednesday discussing, what our approach was, and things have changed, since then. So we can never say where, we're definitely going, but we know that the spread of Omicron is very concerning, and we need all Manitobans to very significantly decrease the amount of contacts they have.
From Global News, Marnie.
Hi, I'm Dr. Roussin. I'm just wondering, for the indoor gathering plus 10 for vaccinated people, how did you settle on that number? Why not just be extra cautious and say household only or household only plus one person, more similar to last year?
Yeah, and I think, we do have vaccines that makes us a bit different than last year, but of course there's Omicron now. I think this is all a balance, right? So we're looking at ways to reduce contacts, and so should that number be 10? Should it be 12? Should it be 8? It's tough to know. What we do know is we have to dramatically decrease the amount of contacts. We know that we went last holiday season, much like you said, without any gathering. And so is that realistic to have that set this holiday season as well? Or should we take that approach where we have a way of gathering, but in a much safer way?
And for interprovincial travel, again, last year people weren't traveling. This year, I think a lot of people have booked flights to go to different provinces over the holidays. Why aren't interprovincial travel restrictions included in this, and what do you recommend to people who might be going to another province?
So I think right now we need to decrease the amount of contacts that we have. We need to pay particular attention to the fundamentals. So if you're traveling within Canada, then do so cautiously. When you get to your jurisdiction you're traveling to, then ensure you're limiting your contacts there. When you return, very close observation for symptoms and testing early and isolation early if you have those symptoms. So we all right now need to focus on reducing the amount of contacts. And I know this is really disappointing. We had an extremely disappointing holiday season last year, and this one is disappointing as well.
From the Brandon Sun, Drew.
Thank you. Dr. Roussin, why is the province not taking a regionalized approach to these restrictions when there is the pandemic response system in place?
So at this time, we did for the orders proceeding up in here, we had a bit of an approach regionally. With Omicron, how rapidly it spreads. Right now, our case distribution is more even throughout many of the regions. We see case numbers climbing in the Winnipeg region now. So, at this point, with what we see with Omicron, how rapidly it spreads, a targeted or regional approach just is not going to be effective.
Okay, thank you. And just as a follow-up, with Omicron spreading so rapidly, will the province do more to give Manitobans access to rapid tests here, like other provinces are doing?
So that is something we're working on, and so I mean, remember, it's not new. We've been distributing a lot of rapid tests for months. This goes to workplaces, and so there's a lot of rapid tests that have been distributed in Manitoba. We're going to continue to do that. We are looking at other ways of having that accessed as well.
And just to follow up on that answer, just today a bulletin went out notifying that First Nation communities and schools in First Nation communities would be receiving their delivery of rapid tests. So we are taking steps to ensure those rapid tests get out and are delivered and distributed as quickly as possible.
From CJOB, Skylar.
Hi there. Thanks for taking our questions. I guess my question would be just on behalf of most Manitobans who have got vaccinated and did the right thing and did as you folks have asked. They believe that would bring on the end of this, and we wouldn't be in this position we are in right now. Business owners are obviously facing now more financial challenges on top of 3 previous waves, and another further disruption to the livelihoods of citizens who thought widespread vaccination was going to be the end. I'm just wondering, what could you say to them right now?
Well, I'd say we're equally disappointed in this. We, with the vaccine push, with a significant proportion of Manitobans doing their part, we really thought that we were creating a path to the end of the pandemic. But Omicron came, and so we need to deal with it. So it's very disappointing, but we were left with little choice but to react to protect Manitobans and protect the healthcare system. So I share their disappointment, but again, the disappointment is not synonymous with helplessness. We have that ability to affect things. We can get our vaccination as soon as we become eligible for whatever dose we're eligible for. We can follow the fundamentals, follow these public health orders. So we're disappointed, but we're certainly not helpless.
Yeah, and I guess just building on that, Dr. Roussin, I think a lot of Manitobans do feel helpless, and most of them will continue to do those things. But where's the light at the end of the tunnel now, as you see it?
Well, I think we've seen this before. We've seen new variants come. I can say that this is very likely not the last variant we'll have to deal with. So we've learned in many ways to live with this virus. We now have vaccination in our toolbox. And we're providing more and more vaccines every day to Manitobans. So we need to continue to do that. We will get through this. All pandemics end, but we just have to again focus on the challenges as they come, and remember that we're definitely not helpless. We have an ability to affect the transmission of this virus.
From the Winnipeg Sun, Glenn.
Yes, good afternoon. I didn't catch on the large sporting events. What is the restriction now on large sporting events? And did the province consider adopting Ontario's plan, which I believe was 25% for large, like Raptors and Maple Leafs games? Did they consider that on when these new orders were introduced?
So we consider all sort of options available. So our restrictions will be at 50% capacity right now. And again, we continue to monitor things, but then we always review a number of scenarios.
And I know you answered a question about interprovincial travel. What about those people who are traveling outside of the country? What words of guidance would you have for them?
So again, I think we're all disappointed. I think there's a lot of people that got vaccinated, did their part, and felt that, finally over the holidays we can get a warm vacation or maybe visiting friends or family outside the country. But we need to be very, very cautious right now. Omicron is spreading throughout the world, spreading very, very rapidly. So my advice is clear, and that's to follow Health Canada's advice to not travel internationally unless it's for essential purposes.
From CBC Radio Canada, Emile.
Hi there. Just wanted to make sure that the 50% capacity was applied both to outdoors and indoors public gatherings, as I understand.
That's correct.
All right, thank you.
We now return to the News Conference Theatre.
Just checking to see, have you heard anything about the ICU nurse request from the federal government?
We are still in discussions with the federal government, and those discussions continue.
Dr. Roussin, you mentioned more resources towards vaccination. So what will that look like in practice? Are we going to expand hours, more clinics?
That's right. So the expanded resources there would apply more to the clinics that we're running, more of the super sites, and so we'll be able to provide more vaccine per day. So early estimates on that and conservative estimates about 1,000 more doses a day. What we'd be able to provide, but that again, it's an estimate.
When would that take effect?
We've moved on this, so this could be as early as next week. Early next week that we'll have those increased resources.
You said that Omicron is kind of something we're still learning about. Let's say we learn that it's more mild, and that even though cases go up, hospitalizations might go down. What's kind of the threshold we need to hit to maybe decide that the hospitals are okay, and maybe these high daily case counts don't really matter so much?
Right, and I mean, this is the big uncertainty right now, and so we are behind many jurisdictions. It's been circulating in other jurisdictions for weeks ahead of us, so we will be able to see what's occurring in those other jurisdictions and make decisions based on that. Now, some of the information we're hearing, puts that the question of whether it's significantly less severe in doubt. We're seeing climbing hospitalizations in many jurisdictions, such as South Africa. So there's some concern that it may not be all that less severe, but it is. Yeah, we'll take the information as it's presented, and if it shows that we're not at risk of overwhelming our healthcare system, then the public health approach changes.
There is some confusion about third doses. In some cases, you have to wait 6 months. I understand there was messaging sent to pharmacies about, if you're close to 6 doses. Can you clarify that for us?
Yeah, so what we're looking at here is we know that there's a decreased effectiveness against Omicron for just the second doses. We know that weans, so the more time out from your second dose, the more at risk it comes. So we have a number of higher risk individuals, mostly age-based. Remember how we rolled out our vaccine, it was more age-based. So the vast majority of those 50 up are becoming eligible at 6 months, near the end of December. What we wanted to do is have as many of those higher risk people eligible now, so before the holidays. So we kept with the 6 months in general, but we didn't want 2 or 3 weeks to affect a 60-year-old getting their third dose ahead of the holidays. So that's why we made that leeway for it. So the 20-year-old, we don't really want the 20-year-old getting their third dose before the 70-year-old. So right now the 6 months is the general rule, but just from the way we rolled things out, if we expanded that to that 5 months, we got a whole bunch of 60+ eligible before the holidays.
You're leaving that leeway to individual pharmacies.
Right.
And why not expand from super sites to more direct targeted, if we want to get the 50-year-olds and 60-year-olds? I don't know where you'd find them, but I mean, are you looking at doing anything that would specifically target them and not wait for them to come?
Well, what we did was with the third dose, when we were developing our third dose program, we didn't have Omicron, so we thought that the disseminated approach, clinics and pharmacies would be the best, most convenient way. And so that's where a lot of our doses are right now. And so, we're very grateful to our partners, the clinics and the pharmacies who have been stepping up, increasing hours. A lot were only providing vaccine on certain days of the week. Many of them are going to expand that. Some were going to not vaccinate over the holidays. Many are rethinking that. So we're really grateful for our partners there on doing whatever they can to get as many of these doses into arms as possible.
Vaccinated individuals and their private gatherings. If I'm not mistaken, it was previously one household plus, another. If at least one unvaccinated person. The new restriction, which is, household plus 5, doesn't seem like a real big difference. And in fact, I guess under the new rules, it could be more than one household. Why are you not making it stricter on that?
So remember with the private gatherings, a lot of it has to deal with messaging, right? It's a very difficult thing to enforce. All right, and so we want to have that message out. So even with the vaccinated, unvaccinated, when we say you can have household plus 10, I don't mean to have 10 different people at your house every day of the week, right? But the orders, technically, could allow for this, right? But how could we ever monitor something like that? So it's really ultimately up to Manitobans to reduce the amount of contacts they have, knowing that if you are at high risk of a severe outcome, you need to reduce the amount of people you're going to be meeting, and maybe the guests you're having over at your place, maybe that includes people who are over 50, over 60, underlying medical conditions. Do you want to be putting these people at risk? And so the ultimate message is reduce the amount of contacts you have. We have to provide some specific guidance. They are enforceable. We can enforce them and do enforce them, but ultimately it's the message. We need Manitobans to step up.
Can I get a clarification on the unvaccinated, if there's one unvaccinated, excluding children? So if families have, a lot of children that they have, they want to get together, what's the guidance for them?
So again, this increases the risk, right? So I mean, when you have a number of unvaccinated people, whether they're eligible or not, it increases the risk. What we did was balance this. We know that some gatherings are going to take place. We didn't want to disadvantage families with young children. Then their ability to gather would be significantly affected. So, but it's again need to balance that. You need to ask yourself if there's anyone significantly at risk of severe outcomes that are planning to attend. And although the orders would allow up a household plus 10, do you need to have a gathering of 10? If you have any unvaccinated people, even if they're exempt, really need to reconsider that. And I know it's disappointing, but Omicron is here.
Minister Gordon, does every member of the Tory cabinet support these new restrictions?
These restrictions will be going out, and as I've said before, we're a unified caucus, and unified in terms of wanting to protect Manitobans and keeping ourselves, our families, and all Manitobans safe. So in that regard, yes, we are unified in these restrictions.
All right, thank you very much, folks.